Freya from the Office of the Children's Guardian for her assistance with presenting this morning. My name is Ellie Fogarty. I'm the Acting Director of the Strategy Branch in the Child and Family Directorate of the New South Wales Department of Communities and Justice. Our branch is responsible for the department's work on child safety and our compliance with the Child Safe Scheme, and we're really thrilled to be involved with the OCG in delivering this presentation today. Before I give just a short introduction, I just wanted to start by acknowledging that no matter where we're all joining from today, we're joining from Aboriginal land. I'm in Parramatta this morning on the land of the Barramadigal people of the Darug Nation. I just wanted to pay my deep respects to elders past and present, and also to Aboriginal colleagues who are joining us today. I don't want to say too much or risk encroaching on Freya's presentation, because I'm sure she knows this much better than I do, but I just wanted to give a quick introduction, I guess, and an overview of the importance. Sorry, I can see a lot of comments coming through suggesting that the sound is not working. Can others hear me, or is it just a few?
I can hear you, Ellie.
Okay, all right, great, thank you. Oh, good, lots of thumbs up, thank you. So I just wanted to give a very quick overview of the Child Safe Scheme and its importance, excuse me, in the roles of all of our agencies. The Child Safe Scheme in New South Wales commenced in 2022, and it really seeks to implement recommendations arising from the Royal Commission into institutional responses to child sexual abuse. So the scheme is really founded around 10 child safe standards, which were recommended by the Commission to be, I guess, the primary framework for promoting child safety in organisations. Our scheme also includes a number of regulatory functions, so processes and mechanisms that are overseen by the Office of the Children's Guardian to monitor adoption and compliance with the standards across our organisations. The scheme currently applies to around 30,000 child safe organisations in New South Wales. They range in size and shape considerably, but the standards are designed to be flexible enough for adoption in that wide range of organisations, from large child protection agencies and government bodies like ours through to smaller recreational bodies that provide activities for children. The scheme is really founded on the philosophy of continual improvement and collective responsibility. It sees the benefits of organisations working together, sharing their insights and experiences around the scheme, and working progressively to build capacity. Under the scheme, several New South Wales government agencies, including ours at DCJ, are also defined as prescribed agencies. Those bodies have some additional responsibilities under the scheme, including a responsibility to develop Child Safe Action Plans, or CSAPs, which contain the strategies that those agencies will use to help promote awareness of the scheme, build community awareness of child safety generally, build capacity of child safe organisations across the sector, and also improve child safety across the breadth of their own work. DCJ released its first CSAP in 2023. You can find that on our website. And one of the things that we've really committed to under that CSAP is to work with our organisations that we collectively deliver services with, that we fund and engage, to try and build child safety across the child protection, out-of-home care, homelessness, and other sectors that we work with. So as part of that commitment, we're really thrilled today to have the OCG join us to help provide some further insight on how the scheme operates, what our various obligations are under that scheme, and how we can work together to share some of our experiences. I really hope that you'll all find today's session informative and interesting. And again, I just wanted to extend my great thanks to Freya for joining us today to deliver the webinar. So I'll hand over to Freya. Thank you.
Thanks, Ellie. That was a really beautiful introduction, and I think a really beautiful way to frame where we're going today with the child safe standards. So as Ellie mentioned, my name is Freya. I use the pronouns she, her. I am a child safe engagement officer at the Office of Children's Guardian. And in a previous life, well, I am still technically a social worker, and in a previous life I've worked in lots of NGOs, so I was quite thrilled to be invited by DCJ to come here today and speak to you all about these standards. There's going to be a bit of a journey for us all together. So I hope today is informative, as Ellie said, and that even you might leave the session with more questions than you started with, because it means you're excited and you're keen to implement them. Before we kick into it all, I just want to take a moment to also acknowledge the lands of the traditional custodians of the land which we live, learn and young people play. I'm on Gadigal land today, and I extend that respect to all First Nations people joining us today. At the OCG, this acknowledgement of country was written by our First Nations cadets and our First Nations staff, and is really quite beautiful. So I might just read it quickly for you, because I think it deserves that justice. We celebrate the longest living cultures in the world, the Aboriginal and Torres Strait Islanders people. We pay respects to elders past and present and commit to respecting the lands we walk on, the communities we walk with. We acknowledge their continuous connection to country, including the land, waterways and skies. We reflect on the ongoing impacts of government policies and practices and recognise our responsibility to work together with and for Aboriginal and Torres Strait Islander children, families and communities. We extend this acknowledgement to all Aboriginal and Torres Strait Islander people present today and recognise the unique and vital contributions they provide in keeping their children safe. As I mentioned, this acknowledgement of country was written by our staff and cadets, and really encompasses as well what we're going to learn about the child safe standards. If you're on Aboriginal land today, which most of you will be, pop it in the chat because I always love seeing where you're all from. Before we get into it as well, I just want to give a bit of content warning. We will be discussing child sexual abuse, which I know can be hard to talk about. But as Ellie mentioned, this is a cultural change. We're opening up the narrative, so it means we have to discuss it to be able to talk about how do we prevent it. However, I do understand that it can be upsetting for people. I encourage you to take care of yourselves today. If you need to step out, that's absolutely okay. Or you can reach out to one of these services online or reach out to your colleagues as well. We will be discussing how we can prevent it, so hopefully that strengths-based perspective will allow you to feel like we can tackle this challenge together. Now, there are quite a lot of people here today, and I'm sure you all have burning questions. My colleague Sky is in the chat today, so if you do have a question, please pop it in the chat. We'll do our best to get to it. No promises. If we can't get to them all today, we will be able to respond to them afterwards, and we'll be able to send that out to you following this webinar. Alternatively, you can also email us at childsafe@ocg.nsw.gov.au if you have a specific question about your organisation that you would like to ask. So either pop it in the chat where everyone else can see that question and someone else might be wanting to ask it, or you can email us directly, whichever works best for you. And thank you, Sky, for being able to answer our questions today. A quick overview of the Office of the Children's Guardian. What do? We do more than just the Working with Children check. We do a lot of work with the systems that surround children, so we are protecting them in that systemic way. That includes our out-of-home care systems and carers registers, children's employment, so particularly for children in the entertainment industry, NDIS worker checks, reportable conduct for conduct within organisations that's harmful for children. That comes to us and we look into it. And the child safe standards. We regulate, oversee and monitor all of these services and add that kind of protective layer around children in that systemic way. Today we're going to be focusing on the child safe standards, however it does connect into everything else as well. And child safe standards is what can all organisations as individual organisations do to help protect children. But where did the standards come from? They started with the Royal Commission into Institutional Responses to Child Sexual Abuse. In 2012, Prime Minister at the time, Julia Gillard, called this Royal Commission due to a lot of reports coming out. It's one of the longest Royal Commissions that Australia's had, with over 8,000 survivors who told their story. Some of them, this was the first time they'd ever told their story. There was cases from over the last 90 years that were heard. The average time for disclosure, and this stat really got to me, it was nearly 24 years on average to disclose that abuse. So for 24 years, children who were harmed held on to that trauma and felt like they couldn't do anything about it. This just really upset me when I heard that, because carrying that trauma is just it would weigh onto you. It would hurt you so much. Out of all this Royal Commission, there was 409 recommendations. And from these recommendations come the 10 child safe standards. We will have a look at the standards and you'll see that they actually encompass a lot of what the survivors told us during the Royal Commission about what could have changed to help prevent it or mitigate this, or make it easier to be able to disclose. In 2019, the Children's Guardian Act added in the child safe standards. Ellie mentioned the prescribed agencies, as well as all the different types of child safe organisations. This is the list of those organisations under that legislation. For the last few years, we've been working hard with these organisations to help implement it. It's been amazing to be able to work really closely with DCJ to see the work that they're all doing, and the learnings we're taking together, because it's a cultural shift, it's a cultural change of how we work with children. But you'll also notice as we go through this presentation that a lot of this information really connects to best practice guidelines already. I've popped up here a few examples from some of your peak bodies, DV New South Wales, ABSEC, FAMS, who have been doing a lot of work with, particularly with the child safe standards. They offer a lot of good practice resources. And as we go through, I want you to keep reflecting back on the best practice which you might already be implementing, such as trauma-informed practice, cultural awareness, governance and accountability, including requirements under ACNC, strengths-based approach, client-centered approach definitely comes into this quite a lot, reflective practice. As a social worker, I love reflective practice, and ongoing quality control of your organisations. Some of you may also have a code of ethics for your profession which you adhere to, and this will also connect into that. But as a resource, go to your peak bodies, see what they've got available, and then tie in this child safe lens into the work that we're doing, connected to the best practice which you're doing every day. I mention this because I think it's really important to say, like, these aren't just 10 standards which are a tick box, they are a cultural fit, they are principle-based, which we will see. And so it's up to you to be able to determine how is this going to look in our organisations, which is a blessing because it means that we can get creative with it because we know our children, young people and communities best. Quickly, I'll just go through the difference between child safe and child protection. They are very similar in terms and sometimes they're used interchangeably, but they are different. So child safe is a preventative approach. How can we ensure children are safe, particularly environments which we control? In this case, we're looking at our work environments. Every work environment in this area, with us all here today, is different. You might have a community centre, you might do outreach, you might take children or young people in a car somewhere, you might meet in the park, you might do community events, you might even do some online work. Any work where we're directly interacting with children is considered our work environment. It consists of our organisational policies, procedures, practices and culture to mitigate the risk. It's about creating safe spaces and environments where children are safe and feel empowered. And it's about creating opportunities for the children, their families and communities to be able to speak up. So we're looking at our work environments with our child safe lens and going, how do we strengthen and protect children even more in our spaces? Child protection is a reactive. It's referring to how we respond to harm. This could be harm we've witnessed, whether within a home or elsewhere, or we understand it's happened. And some of you may work in that child protection space as well. So you can understand some of these practices that you'll be implementing will be, you'll reflect those within this presentation. And then we're looking at within our work environment. So we were wanting to implement these child safe standards to reduce all forms of harm. It doesn't have to be intentional, but with all of our policies and procedures are updated to reflect child-safe practices, and our workplace culture is able to empower our staff to implement these practices. So I've talked about the child-safe standards, and now we can get into them. As you can see, there's 10 standards rather, and they're shaped like a Tetris because they all interconnect with each other. They are numbered 1 to 10, but that's not a level of importance at all. They all connect and they all have different aspects of what we do. but together they reduce the likelihood of harm and abuse occurring within the organisation, that increase the likelihood of identifying and reporting harm, so empowering our staff and empowering our children and young people, and we ensure that all responses to allegations, disclosures, and suspicions of harm are appropriate. The framework, this 10 standards framework, was actually created in direct response to the stories of survivors. These are all things that people from the Royal Commission had said, if this had changed, something else could have changed in their life. To help get through the standards, I've broken them up into 4 different pillars. We've got pillar number 1, which is leadership, culture and governance. This is our top-down approach. This is where our leaders set the standards for our organisations and set that culture. Pillar 2 is about children, equity and families. This is our grassroots. Our top-down can only be informed by our grassroots. So we want to make sure that we're including children, families, and that we're taking diverse needs into account. In the centre of this, we've got our workers and volunteers. We need to strengthen our staff and our workforce to ensure that they are empowered and equipped to be able to handle working with the child safe standards as well. And then number 4 is policies, systems and processes. This is all the documentation that wraps around it all, keeps it all together, ensures that transferable knowledge within our organisations. What happens today is going to be consistent for the next few years until we update it. And it allows organisations to strengthen and grow their practices as well. So pillar number 1, the leadership, governance and culture. This all connects to 3 different standards. Standard 1, child safety is embedded in organisational leadership, governance and culture. Standard 6, processes to respond to complaints of child abuse are child-focused. And Standard 10, policies and procedures document how the organisation is child safe. These documents set the tone for the whole organisation and ensure that there is consistency with practice for staff. It allows staff, communities, children and families to know the organisation is taking children seriously. This consistency is really important. It's part of trauma-informed practice, for example, to have that consistency because it's taking away any other random items that people might want to take on board. It says your staff member today will do the same thing as your staff member tomorrow. It empowers staff and empowers children and young people to know what's going to happen next. Leadership encompasses your board, your CEO, and senior management as well, but it also includes all staff to be child-safe champions and lead the way. In terms of governance, your community and your children who you work with will hold you accountable through reputation as well. So culture is everyone's experience. While this pillar is about that leadership and governance, staff can take that leadership role as well. Everyone has a role in being a child-safe organisation, holding each other accountable and sticking to those policies and procedures, updating the documents to ensure they are relevant to today's standards, and speaking up when something goes wrong. And that's all very well and good, but what does this look like in practice? These are just some examples. As I mentioned, they're principle-based, so you're able to determine what works within your organisation as well. But some examples of what other organisations have done is a statement of commitment. DCJ have a video statement of commitment as well as a written one, which I think is great, speaking about how your organisation is going to commit to child safety publicly. It creates accountability and transparency to build that trust and rapport with communities. Having a look at what policies might need to be updated with a child-safe component. Is it suitable to have just one policy which brings it all together for clarity? That could come under your child-safe policy. You might have a number of policies depending on your organisation where you might fit in child-safe aspects as well. Complaint processes, having a look at those, reviewing those processes externally so all children, young people, families know how to make a complaint should something go wrong. In terms of anything, do they know that process? And when a complaint comes through, do staff know do they know the internal process? Are they able to have those conversations? Documentation, what kinds of documents exist? That could be policies, practices, it could even be case management systems, risk management files, whatever it might look like. In terms of changing culture, discussions as a team. A policy is only as good as how it's implemented. So ensuring that there is a discussion amongst your team about what does child safe look like in practice in our environment. As well, lastly on there, you've got the code of conduct. All organisations will have a code of conduct, but have a look at it. Check it out. See, does it have a specific behavioural aspect to it of how do staff interact with children? Do you need to have different behavioural code of conducts for different programs, for example, because they have different outlines? Something to always just revisit and reconsider with a child safe lens. These are just a couple of examples of a statement of commitment. City of Sydney's just written one and the Y did a beautiful graphic for it. You can get creative with how you want to present your statement of commitment. But to help guide you on it, we have lots of handbooks and resources and we're going to discuss them throughout the presentation. They're all on our website, and if you forget where they are, feel free to email us and we can lead you to them as well. But in our handbook of understanding and developing a child safe policy, we've got some steps of how to develop a statement of commitment. So you don't have to do this alone. We've got some guides to support you throughout all of this. For this one, it's just 7 steps. As I said, you can determine how you would like to present it, I suppose. But the point of it is to have those discussions and go, what do we think as an organisation? Why is child safety important to us? And how do we express that out? We also have a statement of commitment to child safety policy template, which you're welcome to use as well. It can be a helpful guide. So that's pillar 1. We've got 3 more pillars still. But before we move on, I want you to start thinking, what are you going to do first in terms of leadership, governance and culture? I've put up a few examples there which you can use the emojis to kind of highlight which one you might want, or pop something in the chat. These ideas are a way to help everyone come up with how they would like to determine that leadership, governance and culture is going to be implemented in their teams. So all ideas are welcomed. We're not holding you to anything here, but would love to see it, just even some little little images. I can see images popping up. That's exciting. I've seen lots of hearts engaging with your team on the topic. Some organisations have had it that once a month, one task member will research a standard, look into their organisation and present it to their team. I think that's a lovely way to do it. If that works for your structure, wonderful. Reviewing internal policies. I forgot to mention I'm a bit of a policy nerd, so that's something I've definitely done before and I love. And creating posters for children explaining your statement of commitment. Child-friendly language documentation is so important. Sometimes we can get a little bit too adulty with the things that we write, so being able to express that to the children we work with is just as important. Get them to help you design it even. Which then leads us into pillar 2. I know we're not meant to have favourites, but I definitely do. This is my favourite. So children, families and equity. It encompasses standard 2. Children participate in decisions affecting them and are taken seriously. All about empowering children and young people to have a voice, a meaningful voice in decision making, and are taken seriously. This also connects to Article 12 of the UN Convention on the Rights of the Child. Standard 3. Families and communities are informed and involved. This can include working with other agencies as well to best support the child and build supporting a network around the child. While we do place children at the centre of our lens, a child-centred approach, we want to meaningfully involve families and communities as it enhances trust in all organisations and creates opportunities to deliver services that are unique to the community. Standard 4, equity is upheld and diverse needs are taken into account. Every child, family and community are unique, and by embracing diversity, we empower individuals. This may be altering spaces to be maybe more accessible, or changing, putting up some specific artwork or posters or support for different types of groups, adapting our approaches, so not just working with what works for us best, but also considering what's going to work for these children, and recognising cultural difference and celebrating diversity. So what can this look like in practice? We've given a few examples there, but how do we involve children and young people in particular with including voices? Sometimes it could be through a feedback survey, if that's something that your organisation implements, or if you have like a school holiday program, for example, asking them at the end of it, what did you like? What didn't you like? What can we do differently? Obviously, still involve them at the start. We've got school holidays coming up. What do you want to do? We've got this, this, and this choice. And have a robust discussion with them about it. Conversations, so it doesn't have to be a formalised way of please fill out this survey, but conversations with particular family members, communities, and really getting to know what's going on there. Bringing that conversation back to your team, going, hey, I had a chat with this person and they've brought up some good ideas. They've brought up some points that I hadn't recognised. Maybe we can implement some of that. Group work is always a fun way to do it, especially if you've got like homework hubs or play groups. Some of you might have play groups or something like that. That's always a really great way to bring it up and get them involved. It could be designing your space. If you've got like a waiting area, helping them design that, or if you do have a poster, get them to design it for you. Community events are a fantastic way to celebrate your community and celebrate what goes on in your communities. Get them involved. Celebrating specific days as well. This is really important. We've got, I think it's Harmony Day coming up next week after, soon, as a way to celebrate not just different cultures within your communities, but what does that really mean to your communities? What diversity does that bring? What strengths does that bring to your communities as well? Have a look at your communities and what celebration days will be important to them. Ramadan's at the moment. Maybe that's really important. Do we educate others in our services that want to learn more about that? And how do we ensure that people who are currently practicing Ramadan are feeling safe within their communities? In our Empowerment and Participation Handbook, we do have some examples of how to include children. So there's some informal activities and planned activities. I won't go through them all, but there's some really simple ones, like having a suggestion box. I always love that one. I used to work with teenagers quite a bit, and the biggest suggestion was always more food, which is valid because they're teenagers and they're always hungry. So we had to look and looked at what partnerships we could have with Odds Harvest to ensure that we always had sandwiches available for them. It could also be something a bit more formal, such as including children and young people at a leadership meeting. Sometimes this involves a bit more prep work with that young person, prep work for our leadership meeting, so there's no disjointed miscommunication going on, but people understand why they're there, what's going on, and how they can contribute meaningfully as well. On this page, I just have a couple of examples of that might be useful for you. So feedback in your centre, we just mentioned a suggestion box. This is a feedback tree. It's a big public tree where people can stick up post-it notes. Next to it, there was usually a sign that had feedback of, you told us this and we did this. That feedback loop's really important because it lets people know you took their ideas seriously. For a client, it's working with like an individual one-on-one basis. You might want to do a case plan with that client. I used to do them in different colours for people if they wanted, obviously, because it could help them highlight what was more important to them. Orange might be really important, so that's the thing that they would write down first. This one-on-one interaction empowers them to know that they can make the choices. There's also different tools that you can use to help children talk about emotions. On the screen, I've got a picture of the bear cards. These bear cards just showcase different emotions and help children, like younger children, kind of put an image to a word. They might not be able to describe how they're feeling, but they can show you what it looks like, and then you can discuss about it. Where does it feel? What do we do about this? They're a really great way to be able to have those conversations with kids. I think these are like my brain just stopped for a second. With these examples, the purpose of being able to empower children and young people to get involved is that even those small decisions of having more food available, the colours they're using to write with their case plan, it shows them that you're taking their voices seriously, and it builds that trust and rapport. So if something should happen down the track where they've been harmed, they're much more likely to come and tell you about it. There is no voice participation activity too small that doesn't fit into this. So please just have a consideration of where can we include their voices a little bit. A very popular option is the poster competition as well. Children's Week, NAIDOC both have poster competitions, but you could do one for something locally as well. Posters are a great way for kids to be able to express themselves no matter what's going on in their lives. Even if you think they've got lots happening, they mental health, experiencing homelessness or anything like that, sometimes having an activity like this helps them express themselves in a way that just gives them back that little bit of control. So have a think. What are some ways you can include their voices? On that note, what will you do first about this? Reflect on your processes of what's working, or maybe what needs strengthening. Maybe you've got an idea that's been bubbling in the back of your mind and you're like, now's the time, I can try and implement this. Involving children and young people in small decision making. What activities do we do for the day? Do we like oranges, apples, or bananas to have available in the centre? Yeah, or what do they think of the decorations? I've had kids help me decorate before. Get them involved in some of these things. And reflecting on your practice. How do we practice transparency and feedback with children? This feedback is so important. As I mentioned before, it just lets them know they've spoken up about something, you've taken it seriously, and you've fed back to them. Feedback doesn't mean you have to implement it. It just means you're being open with them. Like, we love that idea. Unfortunately, we just don't have the budget for that. We're going to hold off on that, but maybe we can talk about what else is important about that instead and how can we implement that. If you have other ideas, please pop them in the chat and get everyone's brain sparking on it. All right, Pillar 3, workers and volunteers. This is all you. Oops, I skipped it. My apologies. So this includes Standard 5. People working with children are supported and suitable. Standard 7, staff are equipped with the knowledge, skills and awareness to keep children safe through continual education and training. That's those two. So these two fit together. In terms of a recruitment, we want to make sure that all workers and volunteers are suitable for our organisations. So we have full recruitment processes. A working with children check is a must. Must be cleared and verified. That's through our OCG website as well. Child safe recruitment processes. We're going to have a look at that in a moment. But once staff start with you, how are you going to get them to implement those policies that you've been writing and understand them? You have an induction process as well as ongoing training. If you think back to your own induction to a workplace, I bet you signed a lot of documents and I bet you don't remember which ones they were. So consider spreading out maybe your induction process or revisiting through regular supervision with managers and one-on-one. Understand those policies and processes in context of your workplace. And supportive professional development. This can be trainings, lots of trainings available. Your peak bodies have excellent resources and excellent opportunities as well. But it can also include peer mentorship. It can include an activity like a new project someone might be working on that they can get some support with as well. So in our Child Safe Recruitment and the Working with Children Check handbook, we have an example of a recruitment journey. This outlines not just the Working with Children check, but also other aspects that you might take into consideration to highlight that your organisation is child safe. This includes in the job description, but also the job ad. It outlines your organisation's commitment to child safety, so you could have a link to your statement of commitment, for example. Reviewing applications and the history of a work applicant. Where have they worked before? What's going on? Interview questions, including behavioural questions, to explore the applicant's understanding of child safe, not just using the word child safe, but what does that mean to them? What does it look like in practice? That they have the appropriate clearances, the Working with Children check. Your organisation might require an NDIS check or a police check as well. Reference checks, including child safe questions as well, and we've got some examples in the handbook. And then once you've actually hired a person, what's that new starter induction look like? So they have a comprehensive understanding of the policies, code of conduct, processes, and then keep checking in and having those regular discussions around child safe. That was just the example of recruitment, but what are some other things that you think might be able to start with in terms of supporting staff to continuously develop? We've got professional development opportunities for staff, checking out all of our resources on our website. Love to see some thumbs up, that's exciting. Sharing with your local network what you're doing and learning from them. Remember, you're not doing this alone. You're not doing this in isolation. Deal with your networks. It can be obviously within your team, but also talk to your local interagency, for example. What are you doing with Child Safe? What are we doing? Where can we share ideas and resources as well? Professional development is not just something for people to continue and bolster their careers. It's actually a form of self-care as well. We work in pretty tough industries, and so that self-care is really important. The continuous learning and being able to implement something new really helps people feel more connected to their job every day and continuously grow. So it's not just career progression, it's looking after ourselves as well. And pillar 4, policies, systems and processes. So this encompasses standard 6, processes to respond to complaints of child abuse or child focus. You'll note that this was also in standard 1 because it's so important, I wanted to mention it twice. It includes standard 8 as well, risk assessment. Physical and online environments minimise the opportunity for abuse to occur. That's us reviewing our physical spaces, so our centres, the car, where our event might be, but also our online environments. What does that look like? Do we have interactions with kids? Could be on Teams, but is it through text messages, social media? What does that look like for our organisation? Standard 9, implementation of the child safe standards is continuously reviewed and improved. It's an ongoing reflection of implementing these standards and going, what can we always do better? And standard 10, policies, procedures, document how the organisation is child safe. Once again, we need to have it documented so we all are on board about what we're doing, why we're doing it, and how it's going to support us all. Examples of what it might look like in practice. So some risk management plans for those physical and online spaces. We've got guides, we've got 2 webinars, 1 webinar, 2 handbooks about that to support you on that. Specific codes of conduct relating to physical and online spaces. So you might need different ones depending on your organisation. Child-focused complaint process, again, reviewing that, making sure a child knows how to approach the complaint process. Who do they talk to? Are staff equipped for that? And what's the follow-on process as well? Specific policies to online spaces, including phone usage. Maybe your organisation has work phones. Maybe you have a rule about not texting kids. Maybe if you work with 15-year-olds, you're like, oh, I do need to actually connect with them. How are you putting in those mitigating factors then? Once again, documentation, super important. We do have a guide on how to review your child-centred complaint process in our reporting obligations and processes guide. There are 5 key principles behind a good child-centred complaint process: commitment, facilitation, learning, guidance, and resourcing. Have a think through your complaints process. Would a child know how to make a complaint about anything? And who would they make that to? Do they have one person they talk to? Is there a specific person in your organisation where that complaint goes? How are you communicating this with them? Is there a way to communicate it that's not going to intimidate them? Some places have like a poster up saying our child safe officer is with a picture or their name or whatever it might be, so people know who they can talk to. That might not work for your organisation. You might do a lot of more one-on-one work with teenagers, for example, in which case you're reviewing that and understanding how can we implement this to ensure that the child or young person feels safe in making a complaint. Is there a process? Is it on the website? Is it available? Is it on the wall? How is it accessible? And how is it empowering that process as well? How do you feed back to them what's going on? There is a whole guide about it, so please don't feel overwhelmed by it. Have a look at the guide, check it out, and reflect on your own processes as well. Your organisation may already have quite a lot of policies and procedures, and I hope you're not thinking, oh, am I going to have to implement a whole new lot? I want you to first do a review of all of your policies and procedures and consider how do we add this child-safe lens into it. Look at your code of conduct. Do you have a child-friendly version so kids know what that means? Rights and responsibilities, for example. Are there parts of it that we need to highlight in terms of behaviour? Do you have social media policies where you might add a child-safe lens onto it? Or transport policies as well, transporting kids around, sometimes on the bus, or some of these you might already have, and it's about reviewing them and then going, where's the child-safe lens aspect as well? Case note systems. Probably all got a lot of documentation already. How do we make that child safe as well? Phone usage policies, work health and safety, risk assessments, clinical practice guidelines, for example. How does that connect with child safe as well? And of course, once again, the complaints process. So as you can see, like I know a lot of NGOs do have a lot of policies and procedures. We also have a lot of templates for policies and procedures as well. So if you don't have some, don't worry, we've got some guidelines for you to help start that process. The policies and procedures support your organisation. And what do you do? Why do you do it? And how do you transfer that knowledge down the track? So in 5, 10 years' time, whatever it might be, someone doesn't just go, why do we do this? There's a history of why a policy has been implemented and all the changes that have occurred as well. It helps keep that your system, your organisation growing and strengthening as you move along. In our Empowerment and Participation Guidebook, we've also got a guide around how to develop a child-safe code of conduct with children. This can be a bit of an activity that you do if you've got like a group work or you've got some regular young people that come to your centre, for example. And so the code of conduct is for staff, but it's important to include children and young people's voices in this process as well. So one way could be through like a group rules. Participants can help name it too. I've had kids name it their cool rules, or our rights and responsibilities, or just our rules. The process allows you to have a conversation about what does safe look like in the group. Everyone has their own interpretation, so it's to allow for that shared understanding. For example, you might have on there, like on the example up there, listening to each other. What does listening look like to you? How do I know you're listening? How do you know that you're listening? What does it look like? And so you can have these conversations. No swearing. Okay, why is that really important? What does it make you feel like when someone swears? Why should we not swear? Is there a different word we can use instead, maybe? Even the word respectful sounds quite common, but not everyone has the same understanding. So having those deeper discussions about what these words look like and feel like to children and young people and getting them to use their own words. In this kind of activity, you can just sit around. I've used a whiteboard here, but you can do it with some paper and get them to write it up, and they can decorate it. It helps them understand and articulate what it means to be safe in this space, but also helps hold them accountable. So say if you're using the example I've got up on there, no swearing and some kids swear, it helps you say, hey, that's not appropriate. Remember, we came up with these rules. And then it just holds everyone accountable for it. So there is a guide on how you can do that. So where do you think you might start in terms of policies, procedures and documentation? Mapping out the different kinds of interactions you have with children. When you actually start looking at your organisation, it's like, oh, we have lots of different ways that we interact with kids, which is great, and I love that. An internal audit of what systems and policies, procedures you already have. That's always a good starting point. It takes away that blank page almost, and then you can systematically review those policies and procedures with a child-safe lens and add in their review date. Little tip, make sure you keep the previous copies as well of your policies and procedures, and you've just got like a next version opportunity. This is also a great way to be able to communicate to your board what changes you're making at the moment. Understand the complaint process and reporting obligations. We do have a webinar on that as well as handbooks. Do check those out. But ensuring that staff know it deeply, discuss it with them. What does this complaint process look like? Of course, it's perfectly good to have a policy around it, but making sure people really understand it and can implement it as easily as possible. So I've just given you so much information, and you're probably like, okay, where do I start? Which is a perfectly understandable response. As I said, you'll probably leave this webinar with more questions than you had at the start, and I'm measuring that as a term of success. But we do have guides for you as well. We've just launched our Getting Started process, which breaks it down into 6 steps and has been designed specifically for small organisations. You can have a look at that website. It links you to different resources as well, which is always helpful. Also speak to your colleagues in other organisations. Go, have you done this? Where did you start? We also have a child-safe self-assessment. This is an online tool, like a reflective tool. I think it's a really great way to be able to process through your organisation what you're going to be doing. You can do it individually. I've had teams do it together where instead of taking 20 minutes, it's taken them 2 hours because they've discussed it. You can do it now, you can do it in 6 months' time and compare the reviews. The self-assessment's really great in the sense if you do it as a team, it helps highlight where the gaps might be. So while you know that you have XYZ policies, other people might not know that. And so then you go, oh, there's a gap. And so suddenly you know the gap's not we need a policy, but rather we need to communicate the policy. So it is an interesting tool to be able to do with your team, completely up to you. At the end of it, it produces a report and shows you which standards you're possibly doing quite well in and which ones you might want to start with. And it's a nice document to be able to hand to your board as well, with a bit of an implementation plan at the end as well. We have a heap of resources. As I mentioned, you are not alone on this journey. Lots of organisations are undergoing it, and it's about changing that narrative and changing that culture. So we have created so many resources to be able to help you. And hopefully they're all very useful as well. Lots of policy templates. I recognise policies can seem a little overwhelming to write. These templates really step out what to think about and what to consider, and the discussions to have. We've got some short videos that are really good for team meetings. Some of them are sports-based, but the principles behind them are the same. We do have a podcast as well, if you're a podcast person. Lots of guidebooks. Some of the guidebooks do look quite long. They're not chapter books. You don't have to read it cover to cover, but have a flick through them and pull out the parts that are relating to you. That maybe you do the self-assessment first, and then you go back to one of those handbooks and go, oh, this is the thing I want to implement. Where's the guide on that? And we do have a number of webinars coming up. Our webpage is updated once a month, every 6 weeks roughly. The webinars are 90 minutes to 2 hours and are free. They count as professional development as well. So please keep a log of your training records that your staff go to, so they can go to all of these. They're absolutely free. Right, some key points to remember because I have given you so much information. Child Safe is a holistic way to view your service and encompasses all aspects of your organisation. Think of it as strengthening your practices and processes and tying it all together. We already put children at the centre of our work. We're just giving it a new lens now. It's not just policies, it's practice and culture as well. So looking at policies is one aspect. How do you discuss that with your team? How do you ensure that that is being understood? And if there is a misunderstanding or it just doesn't work on the ground, how does that information feed back up and update your policy as well? It's a long-term approach, constantly reviewing and updating your process. Don't think, oh, I haven't done it in 6 months, it means I haven't been able to do it. Not at all. Keep working on it, keep looking at it, keep reviewing it. The more we reflect on our work practices and our child-safe practices, the stronger our organisations become. Don't do it alone. Get together with people in your organisation or other agencies to support each other. Some bigger organisations or smaller ones might have like a Child Safe Champions kind of group where you have people from different teams coming together to discuss the child safe standards, or you might do something similar in your local agency or interagency. Maybe it's a topic you could put on your regular interagency checklist if that's something you go to. Child Safe is for children under 18. However, the principles can support all vulnerable young people and adults as well. So it's still worthwhile having in place. I hope you've been able to see that it does connect to trauma-informed and gives choice and collaboration. It contains strengths-based in that we're trying to highlight what's good for children and young people, what they say is good, and strengthening that as well. And it just connects with other practices as well, including just different cultural practices and understandings. Keep the age of children in mind. A mitigation strategy you implement for a 5-year-old will be very different to a 15-year-old. I imagine a lot of you work with broad range of age of children, so you might have multiple plans in place for different age groups, and that's okay. That's perfectly normal. Even if working with children is not your main role, if children interact with your staff, definitely something to consider. How are we ensuring that anytime a child walks within our space, that they know they're safe, they're there to feel empowered, be able to thrive throughout it all. As I mentioned, you're not alone on this. You can follow our social media. We put updates on or little tidbits of information, for example. You can email our Child Safe inbox for any extra support. If there's a particular resource you would like, you can email our resources team, but sometimes it's just easier to go to the Child Safe team, to be honest, because that way we can just lead you to the same one anyway. But I think that's all I've got for you now. As I said, reach out, don't do it alone. Be excited about this and just keep reviewing your practices. This was just a start. This was just an introductory. Lots of other resources, but get excited about it. Okay, I think that's everything I've got actually. Can I even see the chat? I'm not sure. If there's any particular questions, I'm happy to answer a couple, or I can give you 7 minutes back in your day to go reflect on your child safe practices and start the child safe self-assessment. That could be a good one. I can see people are starting to leave. If that is the case, thank you so much for joining us today. I do appreciate it. Reach out. Not alone. We have lots of resources for you. And I want you to just get excited about all this and start implementing it. Have a good day. Jump on our website. I can see a couple of hands. Antonia? Oh, well, okay, there's lots of hands. I'm just going to go with Antonia because I saw you first. No? I don't. It might be set that you're not able to say things. You can put questions in the chat if you need. I can see a little applause from an SB. I don't know who you are, but thank you. Your hand is up. I don't know what that means. And I maybe cut this out of the recording.
Thank you. We might stop the recording there.
Yeah. Right, stop sharing.
I think it's because there is so